So today, as you can see, we are going to cover the syllabus of applied nutrition and dietetics, which is applicable to the students studying uh, nutrition and nursing, BSc nursing, and any other undergraduate student. So let's move forward. So the syllabus covers certain units, which, as you can see, are the list of units available to you. Introduction to nutrition concepts, which includes various terms and terminology, carbohydrates, proteins, fats, vitamins, minerals, and balanced diet. Now, from unit 2 to unit 6, they are basically what we call the macronutrients and the micronutrients. And the unit 7 deals with the balanced diets. Unit 8, nutritional deficiency disorders. 9, therapeutic diets, cookery rules and preservation of nutrients, nutrition assessment and nutrition education, national nutrition programs and role of a nurse, and food safety. Now, as you can see, it is a very, very vast syllabus which covers what we cover in 3 years of undergraduate education, and which are the fundamentals of nutrition, which a nursing student must know. Now, the most important units, or what we call the weightage units, are unit 2, carbohydrates, then proteins and vitamins. And of course, it goes without saying balanced diet as is an important aspect of health and nutrition. So balanced diet, nutritional deficiency disorders, because these are the ones which are very, very widespread in Indian population and mostly also handled by the nursing staff. Then cookery rules and preservation of nutrients, which a person studying nutrition must know, so that when they communicate with the patients or communicate with their clients, or when they communicate with the other members of the community, whether on one-on-one basis or in a larger group, they have to tell the people as to how to preserve the nutrients when they do the cooking every day. Then, of course, National Nutrition Program, because the government is doing so much more for providing proper nutrition to the underprivileged. Now, Unit 1, Introduction to Nutrition, which covers definition of nutrition and health, malnutrition, under which again is nothing but two different what we call extremes. One is undernutrition, one is overnutrition. Then a role of nutrition in maintaining health, factors affecting food and nutrition. The nutrients, various nutrients we study in future, like in the coming up slides. You can see on your left-hand side the pictorial depiction of these, the classification of food groups or the nutrients, then macro and micronutrients, organic and inorganic components present in food, which may not be considered as nutrients, but which play a very important role in providing immunity to the body, then energy yielding and non-energy yielding nutrients. Now, food, we study the classification of food groups, the origin of the food groups. Now, in the chapter that we covered, or the unit that we covered now, FAQs or frequently asked questions include the 3 types. They may be essays, short notes, and very short answers. Now, under essays, of course, you may be able to know that definitions are very important. So you will have, say, first question, define nutrition and explain the factors affecting food and nutrition. And the second most important essay question is describe the concepts of nutrition and mention the role of nutrition in maintaining health. So this you will come to know only when you study the syllabus in depth. So learn to study whenever you're studying. Don't try to skip anything. In the beginning, we have told you what are the important areas of the various units which you need to study. And in that, what could be the possible questions? Now, short notes, explain macro and micronutrients. Second is classify the food groups. Very short answers, define energy yielding and non-energy, and what are the organic and inorganic nutrients. Moving on, we go to Unit 2, one of the most important macronutrients, because a macronutrient is something which is needed in large quantities by our body. So it includes the composition, starches, sugars, and cellulose, recommended daily allowance, RDA, which is prescribed by the ICMR, Indian Council of Medical Research. They are the ones who formulate the daily recommended allowances of various nutrients from carbohydrates to vitamins and minerals for Indians. So every country has their own RDA, and this RDA is given to us by ICMR after a lot of research and after a lot of survey among the population. Then what are the dietary sources of carbohydrates and functions of carbohydrates? Of course, you need to know all this in order to understand the what are the carbohydrates. Now, energy. Energy is the main source. Carbohydrates are the main source to provide our body with energy. Now, under this subheading, you'll be learning about unit of energy, that is kilocalories. Then what is meant by basal metabolic rate, which is very, very basic and fundamental, and what are the factors which affect BMI. Now, I say questions. Define carbohydrate. Write about digestion, absorption, and metabolism of carbohydrate. How are carbohydrates classified is the second question, which also include list the sources and functions of carbohydrates. These are the two essay questions which are possible from this particular unit. Then short notes, what is BMR? Explain the factors affecting BMR. Then second question is function of carbohydrates. Very short essays or answers it should have been. What is the recommended daily allowance of carbohydrates to be obtained by human body from basically from the food that we consume every day? Third unit is not to be missed at all. Very, very important macronutrient, that is proteins, because proteins yield amino acids, and amino acids they are called the building blocks of proteins. And these amino acids are the ones which are needed by our body to build our muscle. Okay, so very important macronutrient. We will study the composition, 8 essential amino acids, their functions, dietary sources, and protein requirements from according to RDA. FAQs in this, 2 essays, define proteins, explain the digestion, absorption, and metabolism of protein. Number 2, how are proteins classified? What are the sources of protein? What is the calorific value of protein? Short notes, write a short note on essential amino acids, types, sources, deficiency of protein is the second one. Then very short essays. Number 1, give some examples of protein-rich dietary sources and what are essential amino acids. You need to define all that. Let's continue. Unit 4 is fats. Now, fats are something which are very misunderstood macronutrient, but we all need fats in our daily diet and our body needs them. We should never prescribe a fat-free diet to anybody, okay? Because fats, when you study the details in your syllabus, you will learn that fats are components for various important metabolic substances in our body, like hormones and many other things. Okay. Now, in this, we will cover classification, saturated and unsaturated fats. What is the calorie value, the functions of fats, dietary sources of fats and fatty acids, and fat requirements according to RDA. Coming to questions, essay, we will tell about only one question here. Define lipids and explain the classification of lipids. Under short notes, explain the functions of lipids. And second one, explain in detail the digestion and absorption of fats. Very short essays. What is calorific value of lipids? And what is meant by emulsification? Third one, and what are the differences between essential and non-essential fatty acids. It's a very important aspect. Please do not forget to study that. Unit 5, vitamins. Okay. In this, you will learn about the classification of vitamins. Very, very important, which you should know. There are fat-soluble vitamins and water-soluble vitamins, as it defines that certain vitamins are digested and absorbed only in the presence of fat. Therefore, they are called as fat-soluble vitamins. And there are certain vitamins which do not need fat and they are soluble in water. So they are called water-soluble vitamins. Now, fat-soluble vitamins, you should never forget these four, that is vitamin A, D, E, and K. You will study specifically the functions of all these vitamins. Then water-soluble, thiamine, which is called as B1, riboflavin, B2, nicotinic acid or niacinamide, that is vitamin D3 and B3, pyridoxine, pantothenic acid, folic acid, B12, very important component. Folic acid also important for the production and maintenance of red blood cells in the body, and thereby it is one of the important factors. These are the important vitamins to prevent anemia. Then ascorbic acid, vitamin C. For all the above vitamins, you will be studying their functions, dietary sources, and requirements as per the article. Let's see the questions. Essay questions. 2 again. Define vitamins, classify vitamins, explain the dietary sources and daily requirements of vitamin A. Number 2, define vitamins, mention fat-soluble vitamins, explain vitamin K in detail. It can be vitamin A, it can be vitamin E, it can be vitamin D instead of vitamin K. Understand that, okay? You may get related to any of the vitamins. Then short notes. What are the water-soluble vitamins? Write a note on vitamin A. These are 2 different aspects. Water-soluble vitamins separately, you will have to write briefly. Then separately a note on vitamin A, which is, remember, not a water-soluble vitamin, but it's a fat-soluble vitamin. What are the functions of vitamin D? Very, very important role vitamin D has to play in our body, which if I explain now, we are going to cover all that. So instead, you will learn that in your syllabus. Now, very short essays. Define provitamins. Number 2, define night blindness. 3rd is what are the causes of rickets. And 4th, mention deficiency disorders of B complex vitamins. Unit 4 covers various minerals. Okay, major minerals and minor minerals. Under the major minerals, you will study calcium, phosphorus, sodium, potassium, and magnesium, and the trace elements. Functions of these vitamins, dietary sources, and requirements, that is the RDA. Questions. Essays, 2 questions. Explain the absorption, storage, excretion of calcium, and add a note on factors affecting calcium absorption. That is the first question. The second is explain the digestion, absorption, transport, storage, and excretion of iron. Excretion, it should have been. Short notes. What is the daily requirement and functions of calcium? Okay, very essential for everyone. From a child, calcium is a mineral which is essential from an infant, in fact, pregnant mother, lactating woman, to adults, growing children, adolescents, as well as in old age, it becomes all the more important for both men and women. Very short questions. Mention the functions of zinc and copper. Number 2, what are the sources and deficiencies of minerals? Now we will learn about the balanced diet. And in this, the definition of a balanced diet, you can see on your left how beautiful and attractive a thali looks, an Indian thali, which contains the various components of a balanced diet, the principles of balanced diet, the steps to be followed in menu planning, then food guides, basic 4 food groups, and the recommended dietary allowances. What is their definition? What is the limitations? What are the uses? This is very important, girls, or even the boys. Food exchange system, calculation of nutritive value of foods, and dietary fiber. This chapter or this unit is very, very important. So when your teacher is teaching, you kindly pay attention. Nutrition across life cycle, meal planning or menu planning as we call it. What is the definition, principles and steps, and infant and young child feeding guidelines, breastfeeding and infant foods. This unit, balanced diet for various age groups covers, as the name suggests, the healthy nutrition for all the age groups. And don't think that one balanced diet can fit everybody's needs. The various nutrients required are different at different age groups or different stages of life. Therefore, it is not like one size fits all. So what a old person requires is not required by a pregnant woman. What a lactating mother requires is not needed by an adult mother or adult woman. Therefore, everybody has different needs in their body for different nutrients. So we go ahead, diet plan for different age groups, children, adolescents, and elderly. You plan diets for pregnant mothers, nutritional requirements and balanced diet plans. Anemia, very important, and this can affect the outcome of pregnancy. So how to identify that when a woman is pregnant? Diagnosis, diet for mother suffering with anemia, pregnant women, especially iron and folic acid supplementation, and counseling. Counseling, let me just go back. Yeah. So counseling is very essential in order to make the mother understand that how important it is to have a balanced diet. Then nutrition in lactation for their nutritional requirements, diet for lactating mothers, complementary feeding or weaning as we call it. So very extensive this chapter unit has been. So the number of questions which are given under essays are 4, not 5. There is a numbering mistake here. 1, define balanced diet, explain the principles and steps of balanced diet. What is menu planning? Discuss in detail the steps involved in planning a menu. For the third one, discuss the nutritional requirements during pregnancy and lactation. It's truly vast. So putting both together is going to take time for you. Then question number 4, define a diet plan. Describe the role of a nurse in planning a diet for an adult. That is very important. Short notes. We have 6 here. Add a note on food exchange system is number 1. 2, define exclusive breastfeeding and advantages of breastfeeding. Third, what are the different food groups? 4, define weaning and explain the principles of weaning. 5, explain the role of nurse in balanced diet. 6, explain the nutritional needs of teenagers. Very short answers. Define diet for elderly, that is number 1. What is the composition of milk? 2. 3 is what is calcium requirement for a pregnant and lactating woman? 4, explain the naturopathy diet. 5, what is bland diet? 6, explain intravenous feeding. 7, what is a food pyramid? These are all the components of the unit which we covered as a balanced diet for different age groups. Now, unit 8 is all about the nutritional deficiency disorders, which are very, very common in India. There are several in the world, but what we see commonly in India, the Indian subcontinent, is what you can study now. Okay. So first and foremost of biggest problem that is existing is PEM, or what we call protein energy malnutrition. And the magnitude of this problem, you will study how vast it is, how much is it prevalent in the population, what are the causes for it, classification of PEM, signs and symptoms of PEM, and severe acute malnutrition. So when we say severe acute malnutrition, it is nothing but malnutrition which exists suddenly, which occurs and which exists for a short period of time. So it is called as SAM, SAM. It's management and prevention and the role of a nurse in this protein energy malnutrition, prevention and treatment and management. What role does a nurse play? Then moving on, childhood obesity. This is becoming very, very common in India now because of increased consumption of simple carbohydrates, what we call, fast food, junk food, and also a lot of soft drinks, juices, because of the changing food habits of the population. So, what are the signs and symptoms? How to identify childhood obesity? How do you assess the obesity into different grades, its management and prevention, and the role of a nurse? Everywhere we end with the role of a nurse and how important it is. Vitamin deficiency disorders, which covers vitamin A deficiency, B deficiency, C and D deficiency disorders, their causes, their signs and symptoms, management and prevention, and the role of a nurse. Now, this is just kind of syllabus put in short, but this is very vast. As I said, nurses studying applied nutrition and dietetics have to cover a vast range of fundamentals of applied nutrition and dietetics. Then the last part of this unit is mineral deficiency disorders or diseases, iron deficiency, iodine and calcium deficiency, their causes, signs and symptoms, management and prevention, and nurse's role. Let's look at the questions. Essays. Number 1, what is PEM? Write notes on excessive intake and deficiency symptoms of protein. Why we are talking about excessive intake of protein is because nowadays in many of the youngsters, they are going to the gym, okay, and then they have been advised by their gym instructor or influence of the friends. They are consuming very, very high protein diet, okay. That is one of the reasons. That is why we are talking also about excessive intake. Number 2 question essay is mention deficiency and hypervitaminosis of vitamin D. Short notes. Write the differences between kwashiorkor and marasmus. Kwashiorkor and marasmus are 2 different forms of protein energy malnutrition. Now, number 2, what is the role of vitamin A in maintaining vision? Now, very short essay. Number 1, define exophthalmia. 2, what are carotenes? 3, define Wernicke's encephalopathy. 4, what is chelosis? Now, if you're already studying the subject, you will know exactly what these terms mean. So don't be worried about it. You need to cover your syllabus thoroughly while studying it. Unit 9. This is nothing but very important aspect, therapeutic diets. This we teach our students, those who are studying applied nutrition and dietetics in their 3rd year, in their final year. But you will be covering the whole thing. Definition, objectives and principles of therapeutic diets, modifications. How do you modify a normal diet to suit the needs of a sick patient? Like, for example, like you alter the consistency, you can alter the nutrients, and you can alter the feeding techniques also. Consistency means a soft diet, a semi-solid diet. Now, nutrient modifications can be a low sodium diet, a low fat diet or a high protein diet or a low protein diet. That is modification in nutrients. Now, feeding techniques, those studying nursing will know that it can be tube feeding, can be intravenous feeding, it can be total parenteral nutrition, it can be partial parenteral nutrition. Now, last part of this unit is diet in diseases. So what are the kind of diets which are prescribed in obesity? What are the nutrient modification that need to be done? What are the guidelines to be followed? What are the instructions to be given to the patient? Similarly, diabetes. What is diabetes? Classification of diabetes. Then what are the causes for diabetes? And what are the guidelines for a diabetic diet? And you also talk about that what are the foods that need to be avoided or to be eaten in small quantity, foods that can be freely included in the daily diet, how to manage the blood sugar. Then very, very important, that is, you talk about the diabetes management, which includes diet, which includes medication, which includes insulin. You also talk about activity or the role of exercise, the role of other added things like meditation or yoga, then complications of diabetes, short-term complications, long-term complications, how to prevent these complications, monitoring of blood sugars, everything. It's so much more in detail. Then cardiovascular disorders. What is meant by cardiovascular disorders? There are so many in detail. So you'll be studying about each, the role of fat in causing and prevention of cardiovascular disorders. What are the different types of fats and how to maintain the right parameters of fat, like low protein LDL, what we call HDL, triglycerides, what role they have in causing various heart disorders, and what is the type, what are the guidelines, everything. Quite complicated: obesity, diabetes, and CVD management, and also hepatic disorders, renal diseases. Now, much easier to manage is underweight. You will be studying underweight, but not so much of substance is there to study. As I said, in obesity, diabetes, CVD, renal diseases, again, hepatic disorder, the causes, the functions of liver, the functions of kidney, and what are the metabolic changes which occur if the person is suffering from renal disease, and how to control the fluid intake, and what is the role played by dialysis, what are the different types of dialysis. Then hepatic disorders. When we talk about hepatic disorders or liver disorders, there are so many. And then we talk about the functions of liver, what are the causes of hepatic disorders, and how to manage them. More than prevent, how to manage them. Then, of course, simple is constipation, causes of constipation, the dietary modifications, and then diarrhea. What are the causes of diarrhea and how to manage diarrhea with liquid diet, clear fluid diet, and also intravenous. Then pre and post-operative diets, diets to be given for patients to build up their stamina during, for preparing them for surgeries. And the post-operative is how to recoup from the various blood loss and tissue loss. Coming to the questions, it says, what is therapeutic diet? Plan a menu for a diabetic person. Number 2, define therapeutic diets. Explain therapeutic diet for cardiovascular diseases. Short notes, what is therapeutic diet? Again, in a definition form. Enumerate the various principles of therapeutic diets. Number 2, discuss various special feeding methods. 3, define the diet consistency. Classify the diets based on consistency. Very short. What are the supplementary and complementary feeds, and what are clear fluids? As I just mentioned, for diarrhea, clear fluids. Now, going on to Unit 10, cookery rules and preservation of nutrients. Very, very important aspects. Uh, this need not be taught to the people only when they have disorders, but whenever you conduct a community program where you're meeting large number of people, you need to convey this, because when you study the various aspects of syllabus covered under cookery rules and preservation of nutrients, you will think that it's just such a common thing. How do people not know about it? No, the common population is not an nutrition expert. So they do not know. There are a lot of myths and a lot of misunderstandings about nutrition. And you knowing the subject of nutrition should be at liberty to correct those anomalies in the population. So under cooking, you will study the various methods of cooking, like boiling, broiling, steaming, deep frying, roasting, grilling, etc. And what are the advantages and disadvantages of each method, and what is the best method to preserve nutrients. Then preservation of nutrients, which can be, while cooking. So which method helps in preservation of nutrients? Then measures to prevent the loss of nutrients during preparation. What do you mean by preparation? Not the actual cooking process. That is covered upstairs, in the first aspect. But here, when we are talking about preparing the food for cooking, it can be your peeling of vegetables, washing of rice, soaking of things, how much it is going to affect the nutrients and what kind of losses occur during this. One example I'll give you, that you take rice and people wash it minimum 3 to 4 times till you get clear water. That is totally wrong, because to that extent, when you're washing, all the water-soluble vitamins, nutrients, which are present in the outer layers of rice will become soluble in water and will be lost. Again, related to rice, I give you one example. People cook rice in 2 methods or 3 methods. Somebody uses rice cooker, somebody uses pressure cooker, and some families add extra water, remove the starch, and they cook in that way. Removing the starch, again, there is a loss of nutrients. Whereas if you use a pressure cooker or rice cooker, you're preserving the nutrients. Okay, that is one example, and what is meant by measures to prevent loss of nutrients during preparation. Then safe food handling and storage of foods, food preservation, food additives, and food adulteration. Very common nowadays. Various foods that we consume, from milk, from oils to our spices, which we use in daily life, are very much affected by the kind of adulterants which are used. That is why people say that whatever food we are eating now is food without any nourishment, because these adulterants have a very deleterious effect on our system and in various ways, which I cannot explain to you right now. And food adulteration is covered by the Prevention of Food Adulteration Act and various food standards. In fact, I think your textbooks have not replaced. This is the old method of studying Prevention of Food Adulteration Act. Nowadays, we have another term which is used. All the acts of adulteration come under this. It is FSSAI, Food Safety Standards Association of India, or Indian Association. So it is called FSSAI. Okay. Now, questions related to this particular 10th unit. Explain the various methods of cooking and its effect on nutrients, to be written as an essay. Number 2 essay is write a note on household methods of preservation of foods. What are the golden rules to prevent vitamin loss? So you need to list out all the rules. And short notes. Explain the food hygiene and sanitation. Explain PFA Act, Prevention of Food Adulteration Act, which also you will learn the FSSAI Act, since when it came into existence. That is what I suggest to you, because sometimes the examiners might ask only the current data or current information. Okay, so that is very important, that FSSAI. Okay, as I said, Food Safety and Security Association of India. Then third short note is mention various food storage methods, and very short essay is what are the various methods to control food adulteration. Now, Unit 11 covers nutrition assessment and nutrition education. Nutrition assessment and nutrition education. Then objectives of nutritional assessment, methods of assessment. What are nutritional assessment? We know you do generally a health assessment, but health is also related to the nutrition consumed by the patients. So the very important is nutritional assessment. Now in this we have ABCD methods we call, that is under methods of assessment. Anthropometric measurements are A. Then biochemical methods are laboratory and biochemical method. C is clinical examination, which is then again last is D, and that is assessment of dietary intake, including food frequency questionnaire method. So these are very, very important methods, because when you go out into the field or when the patient comes to the hospital for admitting, and you have a dietary department in your hospital, then the dietitians will expect and the doctors will expect that you do assessment of the patient when he comes into the hospital, which is very essential, so that the dietitian and the doctors knows that what is the health status from nutrition point of view, what the patient has been consuming, what is his weight, is the weight correct according to his height and age, and what are the various biochemical parameters, what is his protein status, etc., and what the patient has been eating for in the past. That we do through the dietary intake. Okay. Then comes nutrition education. The purpose of nutrition education, principles and methods. You will learn in detail. That is, if you are needed to do, educate your patient or go into the field for doing any kind of survey, you should know about how to educate a small, one individual, one-to-one basis, a group of individuals, or a large number of population. So you will study about the purposes, principles, and methods of nutrition education. Let us see the questions in this particular unit. Essay, define nutrition education. Explain in detail the methods of imparting nutrition education, which is like covering the entire unit. Short notes, what are the various ways to assess the nutritional status? Discuss the role of the nurse in nutritional education. Now, what are the various ways to assess the nutritional status? As I said, A, B, C, D. Now, you will have to write briefly about each method. Okay. Then discuss the role of nurse in nutritional education. So, again, you take the various methods of nutrition education and explain. A very short essay, define nutritional assessment. You not only define what is meant by nutrition assessment, but you also have to give what are the methods. Only then your answer becomes complete. Unit 12 is the various national nutrition programs which are implemented at the national level by the government. Okay, and definitely there is a role of nurse in implementing these programs. Nurses who work in the primary health centers in the villages or in the city, those who work in the rural areas, very fortunate to be giving such information to the population. And therefore, you need to learn about what are the nutritional problems in India, which we have already studied. Remember, the protein energy malnutrition, childhood obesity, and various disorders of vitamins, both fat soluble, that is vitamin A deficiency disorders, and as well as the complex. You need to identify this, which you have already learned. So you identify this in the population, how to assess that. Then national nutrition policy, then national nutrition program, that is supplementation, the drops, concentrated vitamin A solution, which is given to children when they visit the centers or in the hospitals. Then Anemia Mukt Bharat program, where the pregnant mothers are given what we call the uh, various nutrient supplements which are related to overcoming anemia, that is iron and folic acid capsules. Then ICDS, very important program of the government, which is running since more than 40 years. Okay. And this ICDS covers a lot of things. And you also know the midday meal scheme, which is being implemented also by Telangana government in all the government schools. What are the components of midday meal scheme? How is the midday meal scheme implemented? What that one meal that is consumed by the child, how much of protein it provides, how much of calories or energy it provides, and how it is supplementing the nutrition of the children coming from the underprivileged background. Okay. Then National Iodine Deficiency Disorders Control Program. This is again a very important program because there is a widespread deficiency of iodine in our country, which if it is existing in a pregnant mother, it will be transmitted to the fetus, and the fetus which will be born will have lower mental capacity because iodine is very much needed for the brain development during the fetal stages. And weekly iron folic acid supplementation and others as introduced by the government, and the role of nurse in every program. Now coming to the questions, frequently asked questions, FAQs, essays. Number one, enumerate the various national nutritional programs of India. Number two, explain National Nutritional Program, that is NNP rather. Number three, explain Vitamin A Deficiency Prophylaxis Program. Short notes, explain Midday Meal Program. Obviously, all the questions will cover the entire unit. So the second short note is explain National Iodine Deficiency Disorders Program. Third, what is the role of Food and Agricultural Organization? FO is nothing but Food and Agricultural Organization to improve nutrition of people of all countries. Very short essays. Define the weekly iron folic acid supplementation program and ICDS program. Then how can nutritional anemia be prevented is the second short note. Unit 13, food safety. It covers a definition, food safety considerations and measures, food safety regulatory measures in India, various acts or relevant acts, 5 keys to safer food, how to store food in a proper manner to preserve its nutrients at home and also commercially, how to handle food, what are the basic sanitation measures that we all must take, and while we are storing food, because nowadays more and more number of people are storing food in the refrigerators. So what is the impact of refrigeration and how to handle the food when we are storing in the refrigerator so that it can be safely consumed for a slightly longer period of time, and cooking. What are the safe cooking methods or handling methods? Then we cover general principles of food storage of items, example, especially the protein foods, because people don't have time. They buy milk for 3-4 packets, they put it in the fridge. If you put it in the fridge for longer than 2 days, it will get spoiled. So you need to freeze them. And when you freeze them, how to thaw them, how to take them out of the freezer and get them to room temperature. That is called thawing. So those methods you will learn both for meat and milk and any other food that you freeze. People cook food ahead of time and put it in disposable boxes and freeze it. So how to thaw that food and how to reheat that food and how longer can we do can we do repeatedly reheating? All these you will learn here. Then role of food handlers and foodborne diseases. When we talk about food handlers, we are not talking just about people who stay at home and like mother or a maid who handles food, but we are talking in commercial terms. That is, people who handle food from uh, whom we buy, like in hotels, in restaurants, in all the idli bandis, in the pani puri bandis. They are all the real food handlers. And how hygienically are they handling the food? Okay. And how can it be? Because many a times, as you realize, sometimes if you have pani puri on the road and then next day you have a stomach upset. Similar way, if you have a dosa or idli from a particular area, then that causes foodborne infection. So how to prevent that? Then lastly, essential steps in safe cooking practices. That is what is most important. Questions. Essays describe the personal hygiene of the food handlers. Yes. What should be the personal hygiene of food person who handles the food? There are very, very explicit guidelines for this that explains the signs of good meat hygiene and hygiene of slaughterhouses. Number two, what is the effect of cooking on food? Explain with examples. Short notes, what are the different foodborne diseases? It is very vast, and you need to study in detail. What are the purposes of cooking? Why do we cook food? Why can't we eat it raw? So you would have learned in the unit that is covering these questions. Then very short essay. Number one, what is the safe food handling? Number two, write the steps in safe cooking practices. Now, 15 marks essays. Okay, these are because the PPT that is being prepared is based upon your examination pattern, your question paper pattern. So we will discuss that. Each essay carries 15 marks. And what are the likely questions? Again, it is like we are repeating it, which are likely to come, which have all been put together in one place. So in protein energy malnutrition, carbohydrate, digestion, absorption, and metabolism of carbohydrates. In lipids, classify lipids and their absorption, storage, synthesis, and functions. Okay, and what are the methods used in assessing nutritional status and explain the words in nutritional education? Number 5, preservation and various methods of preservation. Number 6, define BMR, various factors affecting BMR. Number 7, nutritional problems in India and preventive measures. Now, coming to how do you attempt these 15 marks essays? It is very important because they have to be covered extensively. It is not how many pages that you fill up with irrelevant information, but it is essential to know what is the relevant information, what we call, which is available, which for the examiners when you appear for the exam and write an answer. Now, protein energy malnutrition or carbohydrates, whatever it is, you have to first write one para, good amount of para, which gives an introduction. So when you talk about protein and protein energy malnutrition, you need to talk about what are proteins, what is the role, what is the classification, and what is the daily requirement of protein. Then you next para, you start with protein energy malnutrition, the definition of protein energy malnutrition, the classification of protein energy malnutrition, give details of each kind of syndrome, and then management of protein energy malnutrition is very, you need to write a lot about it, and the role of a nurse also you need to mention. And carbohydrates, of course, again, about introductory 10 to 12 sentences, a para about what are carbohydrates, the role, why are carbohydrates needed, what are the type of carbohydrates which are present, which are the carbohydrates, which are important carbohydrates, and a few functions of carbohydrates. Then next para, you must write, that is a para only, digestion. You write about digestion of carbohydrates, the enzymes, the juices which are needed, which part of the gastrointestinal tract the carbohydrates are digested. Then next subheading is absorption, details of absorption, and then third subheading is metabolism. So what is the role of, how do the carbohydrates get metabolized in the body? What is the amount of energy that is released, and how is this energy passed on to the muscle, or is it stored in the body? Then lipids, again, a detailed para about what are lipids, their role or functions, what are the types of lipids you talk about. And then next we go to the main answer, the classification of lipids, their absorption, which part of the stomach, what is needed for their absorption, the storage in the body. All the commas that are given there, they need to be written in the what we call subheadings, and underline your subheadings, highlight your subheadings. It's all up to you, but it should be very, very clear to the examiner. And most important is your handwriting. You have to really do a good job or a neat job of presenting your answers. You know, the first impressions count a lot for an examiner. So if they see a messy paper, lot of scratches and rewriting, that is not a good impression. Never do scratching or rewriting. Or, you know, if you think that you are not able to remember certain answer fully, and you want to come back to it later, leave some space. Don't try to, again, when you remember, to try to adjust in the space that is available. But after every answer, leave certain amount of space. Then what are the methods used in assessing nutritional status? Again, what we call an introduction or a preamble, then actually the methods and the role of nurse. Okay. And in the methods, you talk about A, B, C, D in detail. Okay. That is 15 marks you have to get. So you just can't expect to write all in one or two sides of a paper and expect 15 marks. But please do justification. Okay. And I cannot say write it in 6 sheets or write it in 7 sheets, but complete information that is asked should be presented. Then question number 5, preservation and various methods of preservation. Again, define preservation. You write about classification of preservation, the role of preservation in everyday life or in the community. Then go to methods of preservation. Okay. In detail with side headings. Then define BMR, very important. Then how was BMR determined? Who determines BMR? Who gives, the various, then we go to the next important is factors affecting BMR. Of course, there are a lot of factors which you need to discuss in detail with side headings. Then the last question in the essays covering all your units is nutritional problems in India and preventive measures. You need to write a bit of history as an introduction about what are the nutritional problems, when and how are they assessed, how are they affecting our population, and how is it affecting the productivity of our country. Okay. And then one by one, you write about all the nutritional problems. And last but not the least, you write how to prevent all these nutritional problems. Then we have 5 marks questions or short notes. Midday meal program. All about midday meal. Always remember, you start your answer, whether it's an essay or whether it is a short note, you start with an introduction. And for essay question, the introduction or preamble, it will be much more larger when compared to a short notes. Okay. Then in the end, I will tell you about management of time, food additives and principles, methods of food storage, okay, with side headings. Diet for elderly people, iodine deficiency disorders program, classification of food, ICDS, sources, functions, and deficiency of iodine, vitamin A prophylaxis program, then pasteurization. So everything 5 marks, but whatever is asked, please don't write it in 5 sentences or 6 sentences and expect all the 5 marks. Nobody's going to give you that marks. I can tell you with my experience of 35 years. Then 2 marks, more or less, you need to tell about what is dietary fiber, define it, what are the types of dietary fiber, and then what is the role of dietary fiber. Enough. That is for 2 marks. Similarly, enumerate the signs and symptoms of beriberi. So define what is beriberi and why is it caused with the causes of beriberi, what B deficiency causes beriberi, and then what are the signs and symptoms. That's enough. Then name provitamins of vitamin A and D. So what is vitamin A, vitamin D, then what is the provitamin of vitamin A, and what is the provitamin of D, and what is needed to convert it into the actual vitamin. Mention 4 functions of ICDS. Of course, you have in your textbook a lot of functions of ICDS. From there, you will have to present 4 here. Then what is meant by BMI? Define BMI. What is the role of BMI? What is normal BMI? BMI for an overweight person, BMI for an underweight person, BMI for an obese person. There is a gradation, or it's graded into various grades depending on BMI that you must give. Then enumerate 4 clinical features of overhydration. Of course, when you study overhydration, there will be clinical features. So how to identify this? You can write from there. When they are very specific about, say 4, 5, then stick to 4 or 5. And if you remember, you can always write 1 extra. Then what are the dietary sources of calcium? So here write what is calcium, how is it important for us, 1 or 2 functions of calcium, and then sources. Don't just write the sources of calcium and leave it. If I am correcting your paper, I'll give you half the marks. Then therapeutic diet, definition of therapeutic diet, classification of therapeutic diets. Okay. Then hypervitaminosis. What does that term mean? And when does it occur? For which vitamins does hypervitaminosis occurs? We must give examples. Then what are macronutrients? And do not just write. First, write the definition of macronutrient, then carbohydrates, proteins, one function, importance in the daily diet or for the body, and then you're done. Exam model paper, you can just see this. You will be given, write an essay on any one of the following. That is 3 essays you need to write, and you will get 5 marks each for each essay. Okay. And that is 15 marks. Then the second category of questions are very short. Write any 4 out of the 5 which are given in the question paper. And each question carries again 5 marks over here. Okay, I don't know whether there is a mistake over here. It is each question essay carries 15 marks, and 15 into 3 is 45 minutes. Okay, that is a slight correction. Then category 3, very short answers. You have to answer 6. You will have a choice there. So you answer 6 and each is worth 2 marks, which we studied. Okay. Then choose the correct answer. That is called MCQs, multiple choice questions. 8 will be there and you have to, each will be scored for 1 marks. There is no half mark there, 1 mark value. So you can score full over here without writing anything, okay? So these are the examples of the very, very MCQs as we call them. Coming to the MLP course, which is there in the first year curriculum. You can go to the website of Prakara Education and you can subscribe by paying the amount which is mentioned over here. For BSc first year, they have various courses for which they have prepared the education material like applied anatomy, applied physiology, applied sociology, applied psychology, then nursing foundation 1. Then in semester 2, applied biochemistry, very important, girls. Biochemistry is something which all students find it tough. And if you have teaching modules available for you, then definitely you should go for it. That and look at the cost. The cost is very less. And applied nutrition and dietetics and nursing foundation 2. Now, in this lessons, education material by Prakara, you will find video lectures by experts which are recorded, and students what notes, the key terms at the end of each lesson, and you can also do your self-assessment. Okay, and see, this, as I said, is not just for the nursing students, but what we went through just now, applied nutrition dietetics, is extensive syllabus. This can also be subscribed to by the nutrition students who are watching this particular video of the session, and you can just subscribe and get the various education material related to that as mentioned here. They have given, you can visit their website www.prakara.co.in, or the phone number you can call up 7416600658. Okay, or you can also scan. You can go to the App Store and or the Play Store, and you can install this, and from there you can access all that is needed. Okay, and I'm open to questions. I'm keeping my chat box open. Okay. There doesn't seem to be any questions, and we seem to have completed our webinar on time. Then shall I mute the stop sharing? Shall I stop sharing?
Yes.
Shall I exit the group or what? Exit the meeting?